Hi, welcome to today's presentation. Today we are going to talk about vaginal infections. We've already covered the anatomy and physiology of the vagina in our previous discussion, but today we are only going to focus on the infections of the vagina. Specifically, we are going to talk about bacterial vaginosis. Now, when we say bacterial vaginosis, we mean a condition in which the normal balance of bacteria in the vagina is disrupted. And so it is replaced by an overgrowth of certain bacteria which causes infection in the vagina. Now, basically, a gram, variable rod, which is known as Gardnerella vaginalis, is the main causative agent of bacterial vaginosis. And epidemiologically, we find out that it is most common, or it is the most common cause of abnormal vaginal discharge in women of childbearing age. Approximately 40 to 45% of all cases of bacterial vaginosis, and it is increased in African American women than non-Hispanic white women. The reason for this is not, well explained. And obviously, it will be more in women than men. However, we find out that the urethras of men whose sexual partners have symptoms of bacterial vaginosis are frequently colonized with the same strain of Gardnerella vaginalis. Now, with the pathogenesis of bacterial vaginosis, what we find is that the normal vaginal flora becomes altered through known and unknown mechanisms, causing an increase in the local pH of the vagina. As we discussed in our previous tutorials, the vagina has a pH which is more acidic. And so once the environment gets altered, the acidic environment of the vagina begins to change, and this promotes the growth of other bacterials inside the vagina. And so once there is alteration in the environment of the vagina, we usually may find it from a reduction in the hydrogen peroxide producing lactobacilli. Now, when we say lactobacilli, we mean a large rod-shaped microorganisms which help to maintain the acidic environment of healthy vaginas. They also help to inhibit other anaerobic microorganisms, and they do this through their production of this hydrogen peroxide. Now, normally, these lactobacilli are found in high concentrations in normal vagina. However, in bacterial vaginosis, the number of lactobacilli are reduced greatly, and the number of these other anaerobes, such as the Gardnerella vaginalis, are increased. And so it leads to these symptoms that we are going to see very soon. We also find that there is absence of immune response, and so vaginal epithelial inflammation isn't obvious at all. Now, if you look at the diagram on our right, this is the normal, vagina epithelium with the lactobacillus, inside them. And as you can see, it's about 95% of the, microflora inside the vagina. But if you look at the one on the left, you see that the number of these lactobacillus have reduced greatly, and we are now finding a lot of other bacteria, including Gardnerella vaginalis, occupying the vagina, causing these infections. Now, let's quickly look at the risk factors which are involved in bacterial vaginosis. Basically, sexual intercourse is the main or the primary risk factor in the cause of bacterial vaginosis. Now, it may be from either the woman has a new sex partner, or the woman is having multiple sexual partners, and this alone is a very high risk factor, because once you have multiple sexual partners, it means you're also going to have other STIs. And when you have, sexually transmitted infections, you also stand a higher, chance of getting bacterial vaginosis. Then we also talk about douching. When we say douching is a French word which means to wash or to soak. And so ladies wash out the vagina usually with a mixture of water and vinegar, sometimes with soap and other perfumes. This practice is very common in teenagers as well as in African Americans and the Hispanic women. Besides making themselves feel fresher, women who doge usually say that it helps them to get rid of unpleasant odors and also to wash away menstrual blood after their period. Some also claim that it helps them to get rid of sexually transmitted infections and also even to prevent pregnancies. However, studies have shown that it's not effective for any of these, purposes that they claim, it does. It actually increases, the risk of infections, pregnancy complications, and other health problems, including the bacterial vaginosis itself. Then we also see bacterial vaginosis in women who have recently or have been using some antibiotics for quite a prolonged time. And what happens is that the antibiotics usually alters the environment of the vagina, so it reduces the number of the bacteria, it reduces the number of the lactobacillus in the vagina. We also find it in women who smoke. And this one, there is a bit of controversy over here. Some researchers suggest that due to the antigenic or the anti-estrogenic effect of smoking and the presence of benzopyranediol exposide, or the BPDE, women may be predisposed to bacterial vaginosis. Now, this BPDE increases the bacteriophage induction in the lactobacillus species, and so it's usually found in vaginal secretions. And so, once it is found in vaginal secretions of smokers, it predisposes them of getting these bacterial vaginosis. Then we may also have other causes of these bacterial vaginosis, including the use of intrauterine device, to prevent pregnancies. Now, the take home from these risk factors is that all of them come together to do what? To alter the environment of the vagina, and so the normal vagina flora is altered, and so it leads to the infections which we've just talked about. Now let's quickly look at the let's talk about how to see or identify these infections in women. So basically, what we see is that most of these women are asymptomatic, and so they may be having the infection, but they may not be manifesting there will be no discharge, there will be no symptoms, yet they may be carrying the organism in them, and so they may be spreading it. Now, what we also see is that the vaginal discharge, when they begin to show symptoms, may include profuse, non-irritating discharge. And this discharge is often with a gray or milky, malodorous, fishy, amine odor. And this is usually recognized only or usually after sexual intercourse. And we also do not usually find pruritus as well as pain in these women. And so, looking at this diagram, we find such milky, malodorous discharge from the vagina of such a woman, and you can see how red the cervix has become. Then also, when we look at this diagram, we can see the discharge with these fishy odor. This is how it looks like in some vaginas, as well as the gray, greenish cervical discharge, as we can see. These are normal, or these are real, photos that were taken from other, or from some patients. Now, these are clue cells, and I'm going to show you and tell you more about the clue cells when we talk about the diagnosis of bacteria vaginosis. Now, how do we diagnose bacterial vaginosis? Basically, we do that with the gram stain method, using the discharge from the vagina, and the gram stain is the gold standard diagnostic test for bacterial vaginosis. So what do? We usually use what we call the Amsel criteria. Now, the Amsel criteria, it's four main things that we look for. However, we expect that 3 out of these 4 criteria must be present before we can put the diagnosis of bacterial vaginosis. And so, the first of all, which is the most specific diagnostic criteria, is the presence of more than 20% of clue cells. What are clue cells? These are, this is when the vagina epithelia gets covered with the bacteria, or when the bacteria comes together to they clump together, or they get diffused on the epithelial lining of the vagina, and we call it clue cells. And usually what we do is we take the vagina smear, then we put it on a saline, or we add normal saline to it. So it is the vaginal fluid or discharge which is transferred to a slide. Then we add normal saline to it. Then afterwards we examine it under the microscope, and what we see is usually what we call the clue cells. So if you look at the diagram on the right, this is the normal epithelia or epithelium of the vagina. And so you can see the lactobacillus, beautifully over here. But if you look at this diagram, you can see that the Gardnerella vaginalis have clumped together, when we added, normal saline to it. And so you can see how they've attached themselves to the epithelia of the vagina. Then the second thing that we look for is the presence of a thin white homogeneous discharge, which coats the vaginal wall and also tries to adhere to the vaginal mucosa. Then the third thing we look out for is what we call the whiff test. When we say the whiff test, it is an amine odor noted when we add 10% of potassium hydroxide to these vaginal secretions that we took. And when we add the 10% potassium hydroxide, it actually intensifies the fishy odor that we already smell. And when we find this, we say bacterial vaginosis is present in these patients. Then the last thing that we look for is a pH which is greater than 4.5. Now, like I said before, the vaginal pH is usually acidic, and so when the pH gets greater than 4.5, it means it's becoming more alkaline, and so other bacteria can thrive over there and cause these infections. And so, to summarize the diagnostic criteria for bacterial vaginosis, we use the Amsel criteria. So we have the A, B, C, D, E, F, G. So A stands for the Amsel criteria. The B means it is used in bacterial vaginosis. Then the C talks about the clue cells, which I just explained, as you can see the photo over there. Then we have D standing for a discharge, which must be gray or milky. Then we also have electrons, talking about the pH more than 4.5 or being alkaline in nature. Then we also have the fishy odor of the discharge. Then we talk about gestation, and we say it increases the risk of abortion in women. Now, after seeing this, okay, there is also another, nice photograph of the clue cells in the vagina. Now, how do we treat bacterial vaginosis? The main stream treatment for bacterial vaginosis is metronidazole and clindamycin. Metronidazole is the most common and preferred antibiotic, treatment for bacterial vaginosis. It is available in both tablets as well as in gel, which you can apply, to the vagina once a day for 5 days. And the most effective way to take metronidazole is in the tablet form, usually for 7 days. And this is also the preferred treatment if the woman is pregnant or breastfeeding. Now, we can also use the clindamycin. It's an alternative antibiotic that may be prescribed for the treatment of bacterial vaginosis, and it's also available in capsule as well as cream, which can be applied over there. Now, as part of the treatment, we also need to educate the patient. We need to educate the women. Part of the education comes or falls under the use of these drugs, specifically clindamycin. When we take clindamycin, it weakens the barrier method of contraception, and so these barrier methods, including the condoms, the diaphragm, as well as the cups, their effectiveness is reduced. And what it means is that they are, not effective at preventing pregnancies, and as such, they cannot also, protect you from getting, sexually transmitted infections. And so, whilst you are taking clindamycin, you need to use additional, contraceptions or additional methods of protecting yourself from STIs and also, from getting pregnant. More on the patient education, we need to, also advise the patients to stop, or advise the young ladies and the women to stop douching. As I've explained, douching has a lot, of disadvantages, for these women. Even if they want to wash the vagina, they can as well, wash with ordinary water or some allergenic bar soaps, or even no soap at all. They should just use just ordinary water in washing the vagina, and nothing at all. They should avoid all the over the counter vagina hygienic products. All of them may cause alteration in the environment of the vagina, hence leading to the cause of bacterial vaginosis. Also, the as part of the advice, we need to tell the patient to stop drinking alcohol whilst they are taking metronidazole for at least 48 hours during the intake of metronidazole, and also after the treatment with metronidazole. This is because metronidazole can react with alcohol, and it may cause such an unpleasant feelings in the patient. Now, the take home under the treatment and patient education is that treatment is especially important for pregnant women. And so all pregnant women who have ever had a premature delivery, or also have had low birth weight babies, should be considered for a bacterial vaginosis examination, regardless of the symptoms that they are presenting, and they should be treated if they have bacterial vaginosis. And as such, all pregnant women who have symptoms of bacterial vaginosis should be treated before delivery. Now, let's talk about the prognosis of this bacterial vaginosis. And basically, once we follow the treatment with metronidazole, typically the symptoms may resolve once we finish taking the metronidazole or the clindamycin. Now, the complications of bacterial vaginosis is that when we do not treat bacterial vaginosis on time, or when it's last long and we not do anything to it, it may cause such serious health problems, you know including endometritis, which is the inflammation of the inner lining of the uterus, as well as salpingitis, inflammation of the the ends of the fallopian tube, and pelvic inflammatory diseases. And so the whole reproductive organs gets infected, and it may also cause what we call the tuber factor infertility due to the damage of the fallopian tubes. And we may also have complications, including complications of pregnancy, as we've seen, which may be premature rupture of membranes, premature labor, as well as preterm delivery, and also chorion amnionitis, and also postpartum endometritis. And so, even if you've delivered, postpartum you may have inflammation of your uterus, the inner lining of your uterus as well. So this is all that I have for you, and thank you very much for your